Since January of this year, almost 1,700 people have been trained as part of Niagara Health's Essential Care Partners program. Sonia Pagura, Director of Quality, Patient Safety and Risk, joins the source. Sonia, this is quite a milestone in a very short period of time.
Yes, it is. And we're very proud of being able to implement this very quickly to ensure that our patients have support and authentic partnership in their care journey.
For the first part of the pandemic, there was a lot of concern when people were admitted to the hospital that visitors were not allowed. So there was a lot of consternation, a lot of fear. This was in response to much of that?
Yes. And so I would say that across the province, many organizations understood that not having families and loved ones present had an impact on the outcome and the journey of patients. And so we at Niagara Health, over the course of the summer, in partnership with our Niagara Health Engagement Network, our patient partners, actually started the conversation and working together to develop not only a different level of family presence, but also started planning the Essential Care Partner program, understanding that we knew that there would be a wave two.
And this is not just opening the doors to visitors. This is much more than that. You're training them. Can you talk a little bit about the training sessions that go on for these care partners?
Thank you for actually making that distinction between a visitor, which typically is more social in nature, versus an essential care partner, which is really around the physical, cognitive, and emotional well-being of an individual. And to put that in context, it would be like assisting with care decisions, assisting with bathing or physical mobility or eating. And so the training that happens is really understanding the role itself, how to partner with the clinical team, because it really is a partnership and they are part of the care team, as well as understanding all of the infection prevention and control practices as they enter into the hospital, understanding that we're within a pandemic right now. And so that they feel safe, they know that they are protecting their loved ones, and we're ensuring we're providing them with the appropriate knowledge to protect the most vulnerable within the hospital setting.
You must be getting a lot of feedback from both patients and families. I imagine that it's all positive.
It is positive, absolutely. And we've had individuals who've said that this has been transformational for not only their loved one, but have also offered to help other patients that may not have an ECP. And so we've had a lot of positive feedback. We've also had feedback to tweak our training to make sure that it is very focused. And we continue to thrive in this and we continue to learn. We're not the first organization, but certainly I can tell you within 9 months, 24 other organizations across the province have implemented this type of program from when there was only 2.
You also shared your process and your program with Hotel du Shaver.
Absolutely. And they reached out to us saying, we're getting all of our families saying that they're an essential care partner at Niagara Health. And how does Shaver have their own essential care partner program? So we shared all of our materials, all of our processes to ensure that there was a seamless transition for loved ones as they were still part of the care journey for their loved one. And we ensured that there was a learning together.
To be clear on this, I wouldn't qualify to be an essential care partner for a family member who was just going in for one night. How do patients actually qualify for this?
So it's a length of stay that's 7 days or greater. And it's, again, the conversation occurs with the clinical team and the actual patient, and they identify, is there a need for this? And once that happens, the process is triggered. Having said that, for those who are in hospital less than 7 days, we still do have a process for family presence. And it's really with individuals who've had life-altering situations, or if they're giving birth of a child, or if they're in mental health crisis, or if they're vulnerable, there's still a process to have family presence less than 7 days, but it is a different type of partnership.
Sonia, Throughout this pandemic, I'm amazed at how we've adapted, whether it be in business or whether it be in healthcare. Is this something where you can see it continuing when this pandemic ends, and how would it continue?
This Essential Care Partner program is really part of a larger movement called the Caregiver ID program, which was developed by the Change Foundation of Canada. And it was really anchored in evidence and literature and saying that patients do better when you involve families, loved ones, friends that are self determined by the patient, meaning that they say, I want this person to be part of my care journey. And we at Niagara Health definitely had already thought about creating this type of program as part of our own journey around the Niagara Health Engagement Network well over a year ago. But this will be definitely solidified and continue to grow as we exit out of the pandemic, because it is valuable. You're part of the circle of care. You're really part of that care team. You're helping with some of the decisions. And by having that partnership together, then everyone is able to move more seamlessly through the system.